Ready to go?
Is there like an intro or do you just want to?
You can do an intro, sure. Here's your slide.
Yeah. Hi, my name's Gabby and this is Dr. Cary, and today we're going to be talking about our webinar, Numb Hands and Tingling Feet. People come to you about backs and necks. Why do a whole session just on numbness?
Well, I think numbness affects a lot of people. People have numb hands, numb feet. A lot of times the nerves are getting pinched, and it's a very common symptom we see in the clinic.
Yeah. What is numbness actually? What's going on there?
So numbness is when the nerve is getting pinched and the nerve flow is not getting through to the hands or the feet. So oftentimes when there is a pinched nerve in the neck or in the low back, it can affect the nerve flow going down the line.
Give people a picture of what they can hold on to.
Yeah, I think, I'll use the example of a spine. I've got a spine right here. So if you do have like a spinal segment that's out of place, kind of like this, it can pinch the nerve, and then that can affect the nerve flow going down to your feet into your hands.
Why does this go unexamined for so many years?
I think a lot of people start to get symptoms, and then what happens is they kind of learn how to live with it. Mm-hmm. So initially the symptoms kind of come on and then they go away, come back again. And then what happens is they start to show up for longer and longer periods of time. And as those symptoms continue to progress, get more intense or for a longer duration, what can happen is they go to their doctor for help. And sometimes their doctor kind of examines them and says, don't worry, it'll go away. And then that continues for a few more months or even years until they say, there's something seriously wrong and I need to do something about it. And that can be like years later.
Mm-hmm. Is a numb hand always carpal tunnel?
Not always. You can have a pinched nerve right in your wrist, which can cause a numb hand. But I've also seen pinched nerves in the neck area. And if the nerve's pinched in the neck, it can travel down your arm as well. And sometimes you can have a pinched nerve in the wrist and a pinched nerve in the neck as well. We call that a double crush syndrome. So you could have two pinched nerves causing the numb hand.
Are hands and feet the same conversation?
Hands and feet are similar because the nerves coming from the spine go to both areas, but they can be different too because you're standing on your feet all day. And sometimes as we age, the fat pads in our feet get thinner. So you can pinch the nerves in the feet easier than the hands. But I find with pinched nerves in the hands and numbness in the fingers, that can affect people more because they use their hands a lot for work and their occupation.
Okay.
Yeah.
What are the everyday culprits that people never check?
I think a lot of times people don't check their posture. So, they might be working in a certain position. They're getting used to that. I think a lot of like young people, they slouch, they're looking at their phone, or at their tablet, their computer. And so they can kind of get this rounded back or neck that goes forward, and that can start to pinch the nerves in their neck. So posture would be one. I think repetitive use or injuries, people tend to do things one way. Like we've got some dental hygienists in the clinic. They're always working with the right arm, twisting one way. That causes problems too. And then we've got people that, don't check their nutrition very often. Like they have poor nutrition. They have injuries that never get treated properly. So there's other reasons for it too.
So what actually changes it?
What can change it is properly getting diagnosed. So if you come to the clinic and we assess you, we can find the cause of the problem. Sometimes that's from an examination and a history. Sometimes we send people for x-rays to properly diagnose this. And once you have the right diagnosis, we can do the right treatment for it. So the treatment might involve chiropractic care, but also laser or shockwave. Sometimes we get orthotics for people too, and that can really help them with the proper support and correction for the cause of the problem.
Somebody listening recognizes themselves. What do they do this week?
Yeah, if somebody recognizes themselves as having one of these symptoms, I think you should contact a chiropractor. If you're in the Kelowna area, you can come and see us. We are accepting new patients. If you're outside the Kelowna area, we do health coaching. So you can easily book an appointment for health coaching. I'll meet with you online. We'll discuss your symptoms and then refer you to the right doctor, chiropractor, therapist in your area.
Thank you so much for listening. Please come visit our webinar on Tuesday, September 22nd.